It's low to moderate flow AV malformation according to the MRI and reports. She's had few procedures before, but long time ago. I'm planning to do all of this from inside the mouth, and then for this, if it's possible, after I finish the one that's extending into the cheek, which is about 5.5 millimeters in length and about 3.5 mm. You can see this. Okay, Karcho. Yeah. All right. Lesion. This is the immediate result. We've also done a small extraoral incision close to the eyebrow. We've taken care of that part. One more time. Really large. Okay. You can also the lateral aspect of the eye. So we've taken care of that too. Okay. Okay, that's gone. So here I didn't make any incision outside. Huh? Mm-hmm. I just put some pressure from. Open your mouth. Some more. Is it paining when I do this? Okay. Right. It's healing well, but it'll still take some time. It'll still shrink more. You can have a look at this. You can hold it. See, this side you will have a small scar that won't be visible, but that will go away. But we need to take the sutures off. Here, like I said, little bit excess skin might be there, but the rest of the hemangioma, all gone. We've removed everything. Did you see the specimen that we removed?
Yeah.
Oh yeah, that was pretty huge, huh? It was huge. But by God's grace, it came out like easier than I thought. So I think I asked you, we said, yeah, I want to go on the 6th and all that. You're good to go. Because you've had a very smooth recovery, no bleeding, like everything was totally...
Can she fly with me?
Sure. I think you can go wherever you want to go.
Yeah. Tent I have already booked.
She can go.
No issue.
I think you can go. Unless you have some bleeding episodes after this. തിരിച്ചൊന്നും വരണ്ട മതിയായി finish. These stitches നമുക്ക് നാട്ടിലെടുക്കാം ഇന്നിവിടെ എടുക്കണ്ട because it's only 4 days. Before you go to Dubai, just remove it. It's easy. Anybody will remove. Inside the mouth, don't touch. And important instruction, right side la vechittu don't eat any food for minimum 1.5 months. Because before it heals, if you bite, A, it can bleed, and B, the sutures can come off, and the sutures they're slightly, how do I say, dissolvable, but I've used a little long dissolvable ones. It might be there for 2 months also. Don't do anything with it inside the mouth. The longer the sutures stay, the better your result will be, because more fibrosis will happen. When more fibrosis is there, it shrinks better. That's the logic. And inside also some stitches are there, that of course you don't have to touch. And avoid sleeping on the right side. Sleep straight, sleep left. Eat on the left side. Eat what you want on the left side.
And other things
Sure.
She can eat. On the right side.
Not on the right side. Carefully. Cheek bite varadu.
Okay.
You're eating, you'll be very careful. Don't have anything very hot.
Yeah.
Because the right side might be numb. That's about it.
After 2 months,
After 1.5 months, 2 months, you can do everything normal you can do. Swelling won't be there, nothing will be there.
varanda.
Varanda. That's the biggest thank you. Any Varanda? Yeah, a lot of the patients are like that because we're really in one corner of India, It's difficult for you to come.
No, we have come from Dubai, no? So that's also another. For me, I cannot take a lot of leaves,
Yeah, that is true. Anyway, it's
in case you will be visiting Muscat.
I will be visiting Muscat.
Because I have a Muscat visa also.
Then you can come there if you need.
Give me your Muscat contact number in case of anything.
No, same number you can contact me.
Yeah.
I'll give you my number, you can contact me.
Okay.
My Omani number sometimes is not active.
Okay.
I may not come this month, but next month I
In
might
case
come.
of any emergency.
Yeah,
or
easily you can
anything,
come there.
Okay.
You can easily come if anything is in, but there will be no emergency.
Okay.
I don't foresee for two reasons. Because see, we removed everything in toto first. So there's no chance that some other guy is inside to cause bleeding. Secondly, so far also you didn't have anything. So generally if it's like that, then it should not be anything. So I don't expect any issue. That's why I'm saying you can safely go. Just follow these instructions, take the antibiotics. For now we stop the IV antibiotics, give you tablets, take that. 1 or 2 tablets for swelling. Madi. And your biopsy report, Vanna, I think it's not. One knows it, I have not seen.
Give to doctor.
People have not told me the biopsy report. Yeah, cavernous hemangioma, cavernous angiomas. Right, so you can see here, let them. So this was the hemangioma that we sent from her. It was in the cheek. You can see here, it was a pretty large one. 5 centimeters by 3 centimeters by 2 centimeters. That's a pretty big one. And another one, 1 centimeter, 1 centimeter, 0.5 centimeter. The second one was from this area, which was close to the forehead. And so both of them show dilated blood spaces with endothelial cells packed, which is very suggestive of cavernous angiomas. All right, so that's a good news. So this is not going to recur and it should be settled for life. And also they say it could be an AV malformation. And here are the leash. They've written all the details about the hyperintense honeycomb pattern, everything. All right. Good. So that's it from us. You're welcome.
Yeah.
See, even though I've done, I don't know how many hundreds of hemangiomas, some are really nasty. Some are like this, that go very smooth. It's very difficult to predict because hemangiomas and cavernous angiomas, whatever we do, whatever vessels are there, there are a lot of things. How do I say? It's always, every case is a different challenge, unpredictable. And because of that unpredictability only, most doctors refuse to do anything apart from injections because there's a risk involved. There is a risk, even though you're very good or anything, there is a small risk with this. Like, we always keep blood ready. In your case, we didn't even lose any blood. That we had to even think of it on that lines. But everything has gone smooth. So you take accordingly care. Make sure everything heals and this is just the past then. We put your video on Instagram and I had doctors and surgeons, not one, many asked me if embolization was done. How do you remove like that? Because it was like a big one with full big blood vessels sticking out,
It will be in the YouTube, right? We can also view it.
YouTube is not there, I think. I think I put that surgical thing on Instagram only. I've put. We have a lot of doctors, surgeons, and students following. Not the before after, but like the bloody things.
I saw from this YouTube, I saw videos.
Some of your videos.
Yeah, YouTube will put, but
Yeah.
so much of surgical details we avoid because YouTube doesn't like blood content. Instagram is good because the people who want to learn, surgeons following juniors, they all will get to see. So what we're doing and how we're doing it. All right.